Welcome to tonight's Family Chat Live. I'm Shantae with Parenting Special Needs Magazine, and tonight we are going to be talking about help with accessing care to dentists, hairdressers, and doctors. Oh my. So, what brought you here tonight? Is it the lack of knowledge and understanding from professionals, anxiety with your children because of the strangeness of the environment or discomfort of a procedure, stigmas related to autism and other diagnoses, or interest gaining strategies and interventions? The way we're going to do it tonight is we're going to share stories on the specific topic, which is the hairdresser with your child or accessing care, dentists, and doctors. And so one of our panelists is going to share a story or an experience. And then we have experts that are going to share the strategies that go along with it. But then we all are parent professionals, so there might be things that we're going to be able to share. So that's kind of how we're going to go about this chat. And that way we can all learn from each other. So with no further ado, we're going to pass it to Molly. Please welcome Molly.
Hi, everyone. Thank you so much. My name is Molly Dellinger-Ray, and I'm part of the Partnership for People with Disabilities at Virginia Commonwealth University in Richmond, Virginia. I help coordinate a positive behavior support program there, and I also work on a project that's involved with abuse prevention. But my main reason for being here is that I have a son who is now 31 years old. He was born in 1990 and diagnosed with autism when he was 3. He is the proud recipient of a lot of early intervention, and he's a very successful young man now, just terrific. Super, super proud of him. And we had a lot of stories to tell about dentists and doctors and hairdressers. So I'm happy to be here, and I'm going to pass the baton to Claudia.
You're on mute.
Claudia, you're muted.
Sorry about that. I'm Claudia Axelrod. I'm one of the clinical directors for PBS Corporation. I also have been writing some of the things in the magazine, so I'm excited about that because one is coming up, I think now in April. It's coming out, and I am the mom of 3 kids, and my younger son, who is now 20, also got diagnosed shy of his 2nd birthday, and with a lot of therapy, and we continue to get him as independent as possible. And I used to be a dental hygienist. So I will give you a couple of the tips and the things that we would do or we would recommend. And also some of the stories that happened, to our family with my son, Lenny. And I will pass it now to Tara Cessna.
Thank you, Claudia. Hello, everybody. I am Tara Cessna. I am a board certified behavior analyst. I work with Positive Behavior Supports Corporation and have been working with families with loved ones with special needs since 2003. I have helped families gain access to care, doctors, dentists, hairdressers, schools, you name it, restaurants. And so I'm here to help from the professional perspective and as an expert in positive behavior supports and applied behavior analysis, give you some evidence-based strategies to help you as you navigate the world of trying to access care for your loved one. And I get to pass it off to my friend, Jessica Clark.
Hi, everybody. I'm Jessica Clark. I live in Stuart, Florida. I have a son on the spectrum who is 21. He was diagnosed around age 3. I've had the privilege of knowing Tara for many, many years. She's worked with my son. I'm also have been a stylist in New York and here for 28 years, and I own my own salon in Stuart. And so I've had a lot of experience with not only my own children or my child, but other children on the spectrum, and navigating the whole hair cutting situation. And so I'm just here to help out however I can. And I'm going to pass it to Molly. Oh, no, I'm passing it to Marsha. Sorry.
Thank you, Jessica. Molly, do you have an announcement or do you want me to go ahead? You're on mute.
I'm sorry. I'm just going to interrupt and ask Shantae, our host, to
I'm working
click
on
the 3 little dots in the chat that are next to the smiley face and make sure that our participants can leave comments in the chat because I think the chat has been disabled. And maybe you can do that while Marcia's introducing herself. And if it doesn't work, we'll pause things until it does.
Okay.
Okay, great. Well, hi, thank you, Jessica. And my name is Marcia Quinn. I'm co-executive director for Parent USA. And why I'm here today is I have two boys on the autism spectrum. One is 21 and one is 24, and they are definitely on the two ends of the spectrum. One is nonverbal and the other one is living his best life at college right now. So I'm here to support however I can. I have many personal stories that were not enjoyable at all. A lot of stressful moments for me, a lot of sweating, tears, moments at hairdressing, dentists, and doctors. So I'm open. I'm an open book if anybody wants to ask any questions. I'm just really excited to be along with these lovely women, parents and professionals. So thanks for including me.
Okay. And did I introduce myself, you guys? Because I forgot no, I didn't say who I was. Okay, you guys, I'm sorry. My name's Shantae, and I am the founder of Parenting Special Needs Magazine. I'm also one of you. I'm a parent of a special needs child. I'm also, an advocate for the special needs community. So I'm thrilled. I'm happy that we're able to be here and bring this to you. And I really am hoping that the audience will participate. And I'm thankful for this panelist because I always learn so much from them, like I said before. So I'm asking again if you guys will type in questions and share with us as far as where you're coming from, but also make sure you're part of this because like I said, we want to make this an informal conversation. Like we're chatting around the table and learning about what has worked for others so that we can all learn from each other. So with that, I'm going to pass it to Molly. Oh, wait, Laura. Did Laura get to introduce herself? No, I'm going to pass it to Laura. Laura, I'm so sorry. Oh my gosh.
No, it's okay. Hi, everyone. I'm
because of me. Sorry.
I'm Laura, and I'm a professor at University of South Florida and do a lot of research in positive behavior intervention and supports. But I'm here tonight because I have a son with autism, ADHD, and anxiety. And we are in our transition year to college. So I'm excited about that. But we have had so many issues through the years with all of these things we're talking tonight. And he now has got a crazy beard. And getting him to go to the hairdresser, he'll go, but getting him to actually comb his beard is now a problem. I swear he looks like Hagrid from Harry Potter, but that's okay. It could be worse. That's his little rebellion, but that's it for now. And I think we are on Facebook Live now, Shantae, and the chat seems to be working. So I think we're good.
Okay, good. So we're going to begin with our stories and strategies. So Molly's going to take it away. I think she has a story to share about hair do's and don'ts.
Yes, and I'd love to also hear from, now that our chat is working, I'd love to hear from our panelists or from our participants too, because I'm sure they have some stories. And so when I introduced myself, I said I am the mom of a young man who was born in 1991, and which is a long time ago. He's 31 now. And I keep thinking parents today have it so much easier than we did. But I'm finding, that's not true. And he had a lot of sensory issues, like a lot of kids do. And the cold scissors and the sound of his hair snipping was just really intolerable for him. Plus he had and he still has really thick, beautiful hair. And he is the kind of kid that, when you see a little kid that's got that scruffy little hair, you want to give him a little head pat, and he couldn't stand that. And so I had taken him to my hair salon and asked them if they'd, cut his hair, and they said yes. And he got in the chair and started to cry. And they said, "We're sorry. We don't allow crying. Your son cannot, you can't stay here. If he's going to cry, you have to go." So I found another place, which is old timey. I mean, I live in Richmond, Virginia. This is like old timey guy barber shop with like the twisted thing, the spiral thing outside the door and the high chairs and a bunch of old men barbers who wear those white coats. And I got him in there because that's where a lot of the kids in his preschool's parents said to go. And we got him in there and they sat him up on that huge chair and put the little gown around him. And he was just, I mean, sobbing. And it had gone past the tantrum to the just bewilderment, just sobbing. And his face was, mucus smeared everywhere with hair stuck in it and just so pathetic. And we got through it. And at this point, I didn't even care how his hair looked. I just wanted him out of there. And we got to the car, which was parked right in front. And I opened the door and kind of propped him up into his little car seat. And he did not talk a lot. He barely talked. I mean, that was one of the red flags that we knew there was something that wasn't right. And he like bolted from me and ran back to the door of the barbershop, sobbing, saying, "I want my hair back." And so, that was pretty rough. And now I will tell you, he's 31 years old. He has hair that's longer than mine, and it's gorgeous.
Uh,
It does kind of tell you, he was little, but my son is 20, I said earlier, right? And he just went for the first time without me to get his haircut, and he picked whatever, they gave him a book to pick, and he picked, and he has no hair here now, and then just like a lot of hair just right here. And he came right to show me and said to me, they left me no hair in the back, right? And I said, it's gonna grow. How long? He wants me to tell him exactly how long it's gonna take for that hair to grow. And when I told him 3 months, he was like, oh my God, 3 months? I said, it could be more, I don't know, But I said, you have to be very careful with him. You can't tell him 3 months because he'll clock it, But yeah, they when they can vocalize, they may not like it, and that's why a good story saying, hair does come back, or something where they know that is not a permanent thing. If they get a haircut, would be good, right?
Yeah.
Yeah, for Jessica, I'd love to hear some of the strategies you do, because a lot of the families that I work with, Jess and I living in the same town, I would send them there. I was cutting hair for my clients that was not coming out very well with the sensory concerns that they had and scared of the scissors and the clippers. And Jessica was able to use desensitization training. And Jess, I'd love to hear more about what you did there to help these families so that the kids could have a cut and look a little more typical, right?
Yeah, and I really think the key to this is the pre-planning of this, and really understanding understanding the child or the young adult's expectations, and getting them ready for this. What's going to happen, how it's going to happen, how long, your hair's going to grow back, all that. But also is finding the right salon and the stylist that is or can and will accommodate whatever sensory issues or accommodations that need to be made. And that's key. Most salons do offer free consultations, and that's a good way to get your child or your young adult to meet with them and find out their cancellation policies, and see the salon and see if it's a good fit, see if the stylist is a good fit. Can they make accommodations? Can they come in early? Can they stay late so the salon is a little more quiet? Can they lower the music? There's going to be people and stylists that don't get it. But there's also, I think, unfortunately, there's most stylists probably know someone or have someone in their family at this point who have someone on the spectrum, so are a little more empathetic than back in the day. But I think it's key just to find the right fit for the child, instead of just bringing them into some chain off the whim with, not understanding the expectations and not Also, pre-planning with the stylist, giving them a heads up. These are the issues. Are you okay with my child bringing in a snack, an iPad? You know, can I come in early when it's quiet? Like, and I also think depending on the issues, like sometimes the first visit can just be combing their, if it's, you know, just be combing their hair, put the cape on, or getting to, you know, getting that you know, between the stylist and the child or the young adult, you know, like no kid wants anyone coming at them with sharp instruments that they don't know. So I think it's just really important that the child has know their expectations. What are they thinking? Do they know the hair is going to grow back? Like, what do you want your hair to look like when you leave? Let's look at pictures. Here's what they're going to use to do it. You know, if you like that haircut, they're going to have to use a buzzer, you know, and just preparing the stylist and the child in general. I think pre-planning is key, in my opinion, because I think sometimes we go in quickly, and I think sometimes the parent is a little anxious too, like what's going to happen, how are they going to react, and they feed off our energy. So I think having a consultation beforehand is key, knowing if that's the right environment, the right stylist, and what accommodations they'll allow you to do before going in there.
And I love using like video modeling for this, when they go in and they can see a peer actually, you know, on camera
Absolutely.
getting that haircut, and then video modeling. So when they go in and you videotape them doing it, getting their own haircut, to say, hey, what went well, what didn't go well? Oh, I noticed I cringed, or I couldn't sit through it, mom. Next time we'll try. Next time we'll try to sit through it. So the video can really.
And I had, you know, children, you know, starting out that could, like, I had someone in particular, like they couldn't even touch his ears or whatever. And I let him hold his ears for the whole time for the first 2 haircuts. And we didn't cut around the ear. By the 3rd haircut, he was like, oh yeah, let's go. Like, you just have to find the right styles, the right setting, the right environment, I think. Like, you just have to find the right styles, the right setting, the right environment.
I want to read some of the comments, and I think Deborah was saying that she lets her son have long hair because he steams with it, and I think that you know, I think Laura, you were saying also that helps your son with a beard. And I just want to throw out also that, you know, one thing that Tara taught me a long time ago was that sometimes, you know, because we can change our behavior doesn't mean we should, right? And this is one of those things, right? That yes, we can teach our kids to get a haircut, but at one point or another, I mean, I have a neurotypical older son that for like 5 years, he just did not want a haircut, right? So I think that we have to allow a little bit of that independence and allow, you know, some of those things are okay too. And you know, give them that one thing that they really want in that moment, right? In my house, for example, with Lenny, we have told him this summer, you don't have to get a haircut, right? And he gets as wild as you want it. But the week before the school starts, you're getting a haircut, right? So he knows that's been like the rule, and he doesn't fight me on that anymore. And yeah, the hair gets pretty wild in the summer, right?
It's also making them part of it. Like, hey, let's pick out a haircut. Let's look at pictures. Like making them part of it. That they're making the decision of what they want their hair to look like also.
I also have a question. What since all of you are here, are there books or something, like when you were saying, I know Tara, you said video modeling, videos out there watching a peer, but are there books that any of you use or you know, that are available that we could let the audience know about? Picture books or storybooks like that talk about the hair?
I have not come across one, Shantae, but I have not done extensive
No, I just wondered if maybe anybody knew or had seen something like that, because I thought, you know, little kids, like, how do you, and that's my question too, is how do you know when, how do you know how your young child's going to react until you get him there? You know what I mean? So
maybe we need to make one, Tara.
yeah.
I'm happy to write a book.
I just want to say that if you have a behavioral team, right, they can make you a story for your own child. right? And just a storybook, and it just it can be very simple, right? Of what are the expectations, you know? They're gonna use a scissor, the hair's gonna get cut, or, you know, the noises, because some of the things that we forget, like the noises in the salon, you know, even the
A
blow
lot.
dryer, that it may, you know, may trigger something, right? So, and kind of practicing beforehand, right? Like in your house, you have a blow dryer, right? Making sure that they know this is our blow dryer. There's gonna be a blow dryer there, right? So I think that the more that we prepare them, you know, and be okay if your kiddo does freak out a little bit. It's fine.
But
Right?
I think with the right stylist too, you could do some sort of like short consultation or even a first appointment where you just, if they want a buzz cut, like feel the buzzer or just have the cape on or just comb their hair and not dive right into it. You know, with the right stylist, they'll be, you know, accommodating to that and like understand like it's a process, you know.
Yeah.
I know
And
we want to move on, ladies, to the doctor visits, but I do see that Paula, one of the guests, talks about, you know, her loved one, if they grow their hair out, they need to wash his hair. And that's been the struggle, is the hair washing. So I think too, when we talk about giving them that autonomy to say, hey, you want to grow your hair out? Well, this is what comes with it. It's an if then, right? It's a matter of fact. We call it the PROMAC principle. If they want this, they have to do that. And so if you're going to have your hair long, you're going to wash your hair, and we've got to learn how to put it on a schedule, right? Maybe it's every other day. I don't know your child, but you could put it on the calendar and mark those, and then reinforce that. When you do wash your hair, you get, you know, reinforced with, you know, tangibles or whatever it might be that is important to them. But thinking of how are we going to make that important? And also, typically, I want to look good for my friends in the opposite sex. So making it, if this is something that they're starting to look into, friendships and dating and those kinds of things, this is part of it, right? Getting a job. We need to be clean. We need to have our hair washed. I'm not going to get, you know, somebody looking and interested in me if I'm dirty. So this is also something that's motivating. So we talk to them about those motivating factors to help them wash their hair.
I just want to say one thing, and we got to move on to doctors, but also for the younger families, I know my daughter tangles, I mean, with knots in her hair, because she rocks her hair and makes nice knots in the back of her head. So that wet brush, I don't know, is huge. I don't know.
Wet brush is huge.
Love it.
Huge to get it. I mean,
Where was that when we were kids?
yeah, so I mean, you know, like, anyways, we got to move on to doctor's visits now. So our next panelist that's going to talk about doctor visits, Zipporah is not here, so Marcia's going to fill in.
Thank you. Just one thing, we decided that getting our hair cut at our home was going to be a better option. We were going to have the hairdresser come to our house, and my boys would sit at the front door and see this green truck driving up our neighborhood and would be screaming bloody murder, running into their rooms. I mean, it was a whole fiasco. But so I'm going to share a story from a friend and one of the co-panelists who couldn't be here tonight. So it's Dr. Zipporah, and she is from Virginia. She works with Molly and Flip, and she also sits on the board for Parent to Parent USA, and she's fantastic. But I'm going to read her story verbatim that she shared. Her story is related to anxiety with her 12-year-old daughter who has Down syndrome and autism. She experiences trauma when she has appointments. She has had many invasive procedures done related to this word I cannot say, catheterization, and getting scopes in her throat to figure out issues related to not being able to keep food down. So it sounds like digestive issues. These procedures were done without any pain medicine and often multiple medical personnel holding her down. I know we can all relate to that, having our children, even having to help hold our children down. As you can imagine, this has led to her hating appointments. I started explaining what will happen and then got a composition book and started drawing out the steps. She takes the books to the appointments and enjoys checking off the steps as she completes them. This has helped a ton, and now she gets to get her blood pressure taken, temperature, and weight done with no problems, and is calmer during her visits. So that sounds like a really good strategy. And I know, Tara, you're going to talk more about that.
Well, sure. You know, expectations, right? First of all, how long do I have to be in this? Have any of you ever had to be in those MRI machines, right, where you're strapped down and they tell you you're in here for 60 minutes? I literally count 60 times so that I know when I'm getting out of that thing, because I just don't want to be in there. So helping our loved ones to know how long, what's coming, and what are the order of that, and why is it important? Why does she have to have these things? And for her, it sounds like this is intensive medical procedures that need to be done to help her become well. So, you know, helping her to understand the why as well for that. But expectations are truly important. Again, reinforcement as well, getting through each step. Sometimes we have to take breaks. For us as adults, maybe we can sit there the whole time, but there are some medical procedures that maybe we can chunk for them, right? If you're going to mammograms, maybe we start with one side and then we go, you know, to the other side. You know, if you think about the different exams you get as a female, chunking it, taking breaks, allowing for them to compose themselves and get back in it when they feel like they're okay. But also coping and calming strategies. That's something that we need to teach. And we don't want to teach it when we're there in the setting. We want to teach that every day. So that's something I work with families all the time. When I come to the home, the first thing we work on is our coping and calming strategies. It's deep breathing techniques. Sometimes it's blowing out candles. It's blowing out our fingertips. Sometimes it's going into a safe space within the home. Sometimes it's just sitting and rocking. It really depends on that person, but helping them to learn how to cope and calm first. And then when we get into that situation, we set up expectations. We let them know for how long they're going to be in it. We reinforce throughout, and we teach them and remind them how to use their strategies for coping and calming.
Yes, and you know, Jessica said something very important earlier on, that I think finding the right fit for your child, for that professional, it's gonna be key. And I don't know who said, I think it was Molly that also said that, you know, she asked who they were taking their kids. So we know people, we know a lot of other families, we know friends that have, you know, are in our same situations with kids that have probably had the same behaviors, or, you know, or they go to places that are very acceptance in delicate enough to try to help us, right? As a dental hygienist, my father's a dentist and my brother's a dentist. You know, back then, you know, I mean, my child's 20, right? And I remember like, okay, what we were gonna do, and of course, the dental lights they're special. They really bother our kids' eyes, okay? But they're that you know, specific light to be able to allow the dentist to see well, right? And even the coloring, when you're getting like the colors for the shades for a crown or whatever, so they're ultraviolet for a reason, right? But you can make an appointment, like Jessica was saying, early in the morning, because most dental places, they get like this big windows on purpose because we need the light, right? So get the first appointment available where is the light time. Don't get in the saving time, because then you're missing the point. But get it where it is a enough light so that maybe they don't have to turn that on. Also, maybe you can put sunglasses. Now, if your kiddo has a problem with sunglasses, this is what Tara was saying. You start preparing ahead, right? Then we teach how to wear a sunglass prior to going there. Because if they're gonna need the light, then you need to give them something, because it might affect them, right? Some of the kiddos that I have worked with, not my son specifically, they have epilepsy too. So that could trigger some of that, right? So you have to think ahead and start preparing. Some of the other things is sitting down in the chair, going up and down, you know, Mr. Thirsty, you know, you put it in the cup of water first. And look, the water's going away. This is the same thing that is going to happen. I'm going to put it in your mouth and it's going to take your saliva away, you know, so it takes away some of that scariness, or unexpected sounds or things like that. You know, the little syringe with water and air, I would let them play with it in the hand, right? Or even like the little cup to brush the tooth, right? I would do it in their fingertips so that they can see this is not going to hurt, right? So, but you have to find that person that is going to allow that, and maybe even say to them, the first visit, can we just practice that? Can we just sit in the chair like Jessica was saying, right? So the baby steps to be able to get to the other procedures. But I've had horror stories, like when my father retired and he was outside the country. I venture out to another dentist, and he immediately said, you're gonna have to go to a hospital and get him sedated. Of course, I immediately booked a ticket and went home to my dad, and he was like, okay, you gotta work on him, I don't care, you know. But I mean, realistically speaking, that was 20 years ago. Now you're okay at asking, you know, what are the accommodations? Can I come and practice? And not everybody's going to accommodate. I mean, the world hasn't changed all that much, right? There, like Molly was saying, you know, but there are some good people out there and some people that have experience. So ask around, and I hope that, you know, that you do know that, I mean, there's places that are not going to be good. That's okay. Shake it off and go find somebody else.
And we kind of
I'd
need
love to hear.
check
I'd love to-
I'm sorry.
Go ahead, Shantae.
I was just gonna say, we're gonna do an audience check-in if there's any questions that anybody else has. I was looking at the Facebook page, I was not able to post something, so that's interesting. So hopefully that's not a problem. But I wanted to say too, on Jessica's thing, I think one of the great things you said was preparing your family member for whatever, whether it's going to be a hair appointment or a dentist or a doctor's appointment. So a really key thing for families.
Well, and one, you know, and I'm not proud of this story, but you know, a lot of anxiety from us is passed down.
Yes.
And I had both of my kids at the pediatrician. They had a little finger stick, which was traumatic enough, but we got through that, and they put a Band-Aid on it. And then they were waiting in the lab to get, you know, a shot in the vaccination or something. And as I was standing there, I was holding my son's hand after he had the finger prick with the Band-Aid on it. And I was saying, now, don't worry, it's going to be okay. It's going to be a shot. It's not going to hurt. It's going to be, you know, it's going to be over quickly. This is why you need it, blah, blah, blah. I'm giving this talk. I didn't realize it, but as I was holding his hand, I was squeezing it. And whereas it looked like a crime scene, there were like bloody footprints. I mean, it was blood gushing out of his hand all over the doctor's office. So that gave me a lesson of like, okay, he's good. I'm the one with the problem.
That's why I think it's important for you to meet with, whether it's the dentist, the doctor, the stylist also, because you'll go into the situation feeling a little more calm, like, okay, the stylist gets it. She knows what to expect. I'm not like throwing this kid in the chair. And so your vibe, you know, you're going into a little more like confident, like, okay, the stylist knows what to expect. My child knows what to expect. So that insecurity of yours or that nervousness isn't being pushed onto your child. Either you're going in a little more calm into the situation, knowing what to expect also.
And I think giving, you know, your loved one the autonomy to end things if they need to. Now, I'm not talking about when some things are, you know, severe medical things that have to be done, but allowing them to get out of that situation and coming back to say, no more, no, can't take it, go home, whatever it is, but
Right.
giving them that ability to say, okay, we'll come back and try again later.
Well, that's, I talked to you about that earlier. I said, you know, another thing, every salon's different. We don't have a cancellation policy here, but like also finding out, because hey, if my kid wakes up and they haven't slept all night, it's a bad day, it's not a good day to get the haircut, just find out ahead of time. You know, you don't want to be charged for a haircut, but like give them a heads up, like, hey, we might wake up that day. I don't know what your cancellation policy is, but I'm not going to put you through that or him or her through that if it's not a good day, because we all know those days happen. Okay? Or it's just not the day to do it. But I'm not going to put you through that or him or her through that if it's not a good day, because we all know those days happen.
Yes. And trust your gut. You know, if you feel like that's not the right doctor or stylist or dentist for your loved one, it probably isn't. Your gut, you know, if you feel like that's not the right doctor or stylist or dentist for your loved one, it probably is.
And I think I had jumped the gun and I went from, it started the dental part and the medical one. that I wanted to tell you that there are a couple of things in the dentist that, you know, we might be aware of or might not, but or maybe we are aware, but we don't know, you know, how to request that. But you know, there's, if you have your child, getting our kids to brush their teeth could be hard, right? There are some toothbrushes that have 3 surfaces. So if this is the tooth, you can brush all 3 sides at the same time, right? I suggest, I don't know if anybody was in speech therapy, they use something called a nook. It's just like a little something that they can bite and chew, and it has like little sticks at the end. You can use one of those. You can order them online. They're like $2 or something, right? And what it is to kind of go over, so to take away some of that sensitivity that might be. Remember, I mean, dentist is very intrusive, and I bet you, because I'm probably the only one that loves to go to the dentist here, right? Because my dad and my mom, you know, you know, everybody in my family is either a hygienist or a dentist, right? But in reality, you know, think of those things that they were saying about like not passing down that over emotional. But there's things to take away some of that sensitivity from the mouth. Flossing, guys. If you don't want cavities, gosh, I cannot tell you, flossing and brushing, it's the way to go. Just like we were saying, like, you know, like you don't want to get a haircut, then you have to, I mean, you have to wash your hair, right? Well, you know, and I'm asking for something hard because it's hard to brush their teeth. It's hard to do this, but you know, they have the actual, they look like a little Y with a little floss in the middle. And you just can go in there, and it doesn't have to be perfect, but it's better than nothing. And you don't have to learn how to do with your fingers and all of that. I mean, that's my son Lenny uses that since he's the little boy, and he's so good at it, and he will not, like, I mean, he's like, I only have 3 more left. I need you to buy me more, because, you know, I told them, you know, you don't like the dentist. You don't like to go, because he has verbalized that. I don't like to go. I said, well, if you get a cavity, you have to go, right? So there you go. You brush and floss. So give them that expectations, but give them the tools and let them play with it and whatever, and have them see you do it, right? Like have them see that you are actually flossing with this thing in there, because then again, you're showing that you're okay doing this for yourself. And this is a practice that I recommend. You know, when I was a hygienist, I used to say, you only floss the teeth you want to keep, you know, but really try to use some of those sensor. I mean, for years, I was like, I wanted to get like one of those electrical toothbrushes for every single one of my kids, because, you know, like I thought, okay, how fast it is. Lenny cannot, for the life of me. That's one thing. He just, the vibration just is too much for him. So I gave up on that idea. Right, but he, you know, and he now brushes. Oh, and I put a mini timer, like 2 minutes. It's something like this, but it's smaller. And they also sell them, or the dentist can get them for you. You know, and I'm telling you, you put it, it's 2 minutes, or you put a song when they're older. You just put a song, the end of the song. You know, it doesn't have to be too long, but it cannot be like 3 seconds flat, right? Like they can pick the song they want, and you're not done brushing until the song, right? So things like that to get them to really get that oral health better, so that you don't have to go through the cavities and things like that. There's fluoride gets a very bad rap, but if your kid gets spit out, do fluoride, right? So that you don't get that many cavities. So there's a lot of things. There's drops or pills that you can use. You can ask your dentist, and you can put 1 or 2 drops and you spit it out, and then your teeth become pink or purple if you have plaque. So I used to use that with my kids all the time. And I used to say, okay, let's see, random check if you're brushing your teeth good. And they were like, oh my,
I like that.
You know? But the kids, I mean, when they're little, Lenny actually liked it. He was like, oh, I miss here, you know? You know, so So there's little tools that you can ask your dental hygienist to help you so that their dental health is better, so that you don't have to go through that many cavities. And some people get more cavities than others. I get it, you know, but these are some of the helpful things. You can get sealing also, you know, some insurance cover it, some don't, but a seal in the tooth before they get a cavity, you know, and that doesn't hurt because they don't have to drill, you know. So little things like that. Preventive dentistry will help us a lot so that we don't have to go into like a root canal with one of our kids, right?
I have a question. Well, and also I interviewed someone one time, they had trouble with their child brushing their teeth, and they said finally watermelon toothpaste was what he would use. So sometimes a different flavor or something that makes makes them happy about it. But also I wanted to ask Claudia, how do you like help? What if they're afraid of the dentist? Like any tips or tricks or strategies, or maybe that's something Tara can address? I mean, how do you help them gear up for that?
I would say just quickly first, I would just take them, go see the office, right? What is that? Let them go up and down the chair. I mean, that's cool. Like, look, this goes up, this goes down. Like, oh, you wanna blow me some air? Be careful because it blows water too. So sometimes I would get all soaked because I would let the kids like play with it with it's called air and water. So make it playful, and then the parent, like is excited, and you can prepare like certificates. You did a great day in the dentist. I mean, it doesn't have to be something elaborate, but I think that part first. And also, if you have siblings, use that. It's his turn to go to the dentist, so then you go see that other person. Okay.
Just to add to those things, autonomy, letting your child, like you said, choosing their toothbrush, choosing the toothpaste, choosing the time that they brush, right? Do we want to brush it before dinner, after dinner? I know typically after dinner is best, but we can ask them, and before breakfast or after breakfast, put that in their visual schedule, but let them pick those times. There are toothbrushes that actually play for 2 minutes. They play a song and it stops when you should stop brushing. They have mouthwashes that turn your mouth blue that you can see where you missed. So they have all of those things that really help us. And so this is just, we're sharing some evidence-based strategies. There should be, I thought I added, it might be on the next one, Zipporah's schedule, if you wanted to share that. But this is, again, these are visual supports and visual schedules. You can draw them if you so wanted, where your loved one can just check off after those activities have happened and occurred, knowing when they're going to get reinforced. What I used to do with my kid's dentist is I would bring things in that my children loved and hand them to the dentist so that he could give them to her, to my boys when they were done, right? Because that wasn't something that they did, but it paired my dentist with my boys with something that they enjoyed. They got it tangible when they were done. And so it was just a great way for them to want to then go to the dentist. Most dentists now probably are doing those reinforcers. Mine weren't at the time, so I'll provide them. I don't mind. I'll go to the dollar store. I'll get some trinkets that I know my kids will enjoy, and I'm going to pair them so that my dentist is reinforcing. But I liked these. If you want to go back to the other ones as well, we talked about desensitization training. This is where we're sitting in the chair and we're not necessarily getting the haircut yet. We're not necessarily getting the tubes in. We're not necessarily getting the cleanings yet. We're working into that. We talked about video modeling and video self-modeling, watching. And when we watch ourselves do things, it's really funny. I'll train somebody on something, right? We do a great job, as I think we do behavioral skills training, and I give them the reinforcement and the feedback, and we practice and we rehearse and we do all of the things, and then they act it out and they miss steps. And when I go back and I say, hey, well, how did you think you did? What do you think you did well? What did you do not well? Oh, I did it perfect. I nailed it. And I say, well, I'm going to videotape you doing that. And then I videotape them, and they can see all of the ways that they may have not done it well. So for example, I had a child that used to enter the classroom, but as they would enter the classroom, they would be spinning around and they would knock things off the table, and then they would go put their book bag up, but then things would fall out of their book bag, and then they would get to their desk, but then they would slip the chair out and they wouldn't sit, and they're doing all of the things. And I say, remember, when we come into the classroom, we hang up our book bag and we sit at our desk. When I videotaped this child, they saw all of the other behaviors that they were engaging in. They're like, oh, okay. And then they were able to just go in and do it. They recognized, oh, I recognize where I didn't do it well and where I failed and where I could do better just by watching themselves. This is a social story. Again, we would create these. They're unique. They're individualized for your loved one. This is something we read prior to going to that event. You can read it the week before, every single day if you so wanted, a month before, depending upon the anxiety that your child might have for the event that's happening. And you read this to them, or they can read it with you, share those stories. And then what's going to happen, right? Pretty soon they learn that social story, they've memorized it, and you can ask those questions back. And then when are we done? And then what are we going to earn? And, I'm going to be very proud of you, and all of the things, right, that go along with you completing what needed to get done. So these are just some of the strategies, we use to help individuals get through these things because they are so necessary.
I love that video self-modeling. Like, and who
Great.
records it? Who, like, do you have the teacher recording it? Or are you there?
Yeah.
Okay.
So the teacher, somebody else, they don't record it, but somebody else is recording them, and then they get to watch themselves doing it, and they get to critique themselves to say, what did I do well? What did I not do well? What can I do better? And sometimes they nail it, and they're like, I nailed it. And you're like, you know what? You did. Great job. This is the video I'm going to share with everybody else because you did so great. But they love watching themselves too. Right. It's another, who doesn't want to watch themselves, right?
No, I love that idea. That's a great.
And then they get smart, right? Like Lenny, I've done video modeling for so long that when I started getting my camera, right, he's like, okay, I know what I did wrong. Give me a minute, okay? It's almost like Groundhog Day, right? Like he wants to restart from the beginning, and don't take me now. Let me restart.
Yes. And if it was Jessica's son, he'd make sure his hair was looking good because he always had to look good. Like he knew about his hair. It was like, wait.
So metro, I know.
Yep. He had to look good. I'm like, all right, Cole, I'm gonna wait for you to fix your bangs. And then
that's the one thing I don't have to worry about with the dentist because he's so he loves going to the dentist. He begs, but he's very metro. So, gotta get the teeth and the hair looking good.
A good looking kid.
Awesome.
Do we have anybody in the chat?
Yeah, any questions? No, we don't, not that I'm aware of. I see Emily's on there, but thanks, Emily.
Some of the other things I just want to put out there, access to your preferred community outing. So even restaurants, right? This is something families do. And oftentimes I hear that they can't do these things. So I think enlisting your community to see when you can go. There are certain restaurants that will close for lunches, and sometimes they'll open for you to bring your loved one and have a meal there, to practice waiting, practice ordering, practice, the accepting no, doing all of the things, right, that go along with eating in a restaurant before you can actually go when it's actually busy. Again, that's just practicing. It's just something that we want to work on, and setting them up for success. Going to Target. I would call our local Target and let them know I'm bringing somebody in that struggles with behaviors, and you're going to find that we're going to act in a different way that you might expect. And please let us come in when it's not quite as busy. Please let us shop and do what we need to do without harassment from other people. I would carry a little card with me that said, because everybody wants to interject when there's big behaviors going on, everybody in the community wants to give their opinion on what you can do better, right? Why is your loved one screaming? Why are they laying on the ground? Listen to your mom, you're not doing a good job. And it's like, you don't want to engage with those people. So all you do is hand them the card. We're working on a community outing. We're here practicing. My loved one needs space, and we appreciate you letting us practice in this social setting. That's all you have to say. They don't bother you anymore. Just, I can't talk to you right now. I'm focusing on my loved one or my client, and I'm going to hand you this card, and they know I'm going to back off now. So using those social outing cards are very helpful to me. These are just resources that we wanted to share for caregivers. I love these. I think Shantae, you shared them. They're from the Parenting Special Needs magazines. So if you want to talk a little bit more about these.
I think they're about going, say dentist trips and different tips using positive behavior support, and different tools and the ways that you can, and strategies, I should say, all of them. Shopping without dropping is the very end. It's about a mom that, same thing, goes to Walmart, but takes the time, and then also understanding their child. And that if you tell them something, setting the expectations, if you're only going to say, I'm going to the store and doing this and this, make sure you only do that, the two things that you say, otherwise you can, have meltdowns. But anyways, the articles are on there. Say, those are the titles of the articles, and you can find them on the site. And what else was I going to say? I was going to share. So I wanted to ask something. When you were saying, I wanted to ask a question, Tara, when you're saying, when you go to the restaurants for the kids that have to practice, so do you just call them when they're not busy and just say, hey, is this can you kind of what you said it, but you said it fast and I didn't get it. So
sorry, I do talk fast. So I called restaurants. I called around the town of where a family that I was working with lived. And I found to see, do you close at any part of the day that you would open for me to come in to practice eating at a restaurant with somebody with special needs? And I found this Italian restaurant in Jupiter in Abacoa, and they closed for lunch. They were in the middle of the day. They were open for lunch, closed midday, and then prepped again for dinner. And they let us come in and they served us. And I tell you, it wasn't pretty. We broke a booth. We had, the cheese was thrown, the crushed red pepper was thrown, all of it was thrown. And I said, leave it on the table because I want her to learn that this is what it's going to look like when you get to a restaurant. It's not sterile like, you would expect. And so eventually we got to eat at the restaurant where she could tolerate the sounds, the noises, the waiting, all of the things. You don't get to just eat pizza. You have to also eat a salad. You have to have all of the things, but they worked with us. They were very kind about it. I let them know what to expect. I let the waitress know exactly what to do. And she started dropping and throwing things. Please back away. I'll handle it. You're not in any danger. You don't have to interject in any of these behaviors, certainly with Target as well. I called the manager up. I mean, we had guns drawn on us from the security guard because why do they put red wine on the end caps next to, her preferred food and toys? Why is that red wine there? So she proceeded to drop every single bottle of wine and then drop herself on the ground, and they didn't know what was happening. And she looks like an adult, 6'4", 230 pounds. It looks scary, but I said, I handed them the card. I'm working. We got it. Please step away. I'll clean this up. I'll come back in an hour. That's what you got to do.
Wow.
And guess what? Now she's accessing all of her care. She's going to dental, right? She's attending school again. All of the things that she wasn't doing because her behaviors were so prohibitive and just so outlandish that people just didn't want to deal with it.
Well, I'll interject a little bit with the restaurant thing. I just want to say, because Cole does work at probably the nicest restaurant in our area, my son,
Yes.
but on the spectrum. And they're so accommodating. They let him do his hours between lunch and dinner. He does his thing, his napkins and his table setting when it's the least busy. And they're very accommodating. If they just know what to expect, I think, I'm not saying everybody, but they are very, very good to him. I think where he works, Kyle G's.
My foster son works there too, because he also is on the spectrum and he was
Yes.
struggling in other jobs.
Yep.
And
I mean, he gets paid more than my assistant gets paid here. So he is, they treat him very well, but he's also, they accommodate, like, all right, they love him. They love he's like a robot when he goes in there, done, but he's able to do the hours that are like 3 to like 5 or whatever, when it's the least busy, accommodating.
and he's employed. Like, that's what we want. We want our loved ones engaged in meaningful activities in the community, whether it's through volunteer, whether it's through employment, gainful employment, however. So this is a great way to engage your community. Those small business owners, they want to help us. They want, and they also get kickbacks for it. Actually, it's a benefit for these.
Well, it's a great
owners.
model. This is a huge restaurant in our area. They own a lot of restaurants, so it's a good business model. Hopefully other people will take notice of that.
Yeah,
Our children
absolutely.
practice in so many areas that, it's the repetition.
Yeah.
There's a comment in the chat, and I don't know, Claudia, if you can answer it, but it's from Rachel, and she says vibration from dental cleanings or cavities are always a problem. Are there ways that dentists can use alternative methods without vibration? And it's true. The smell and the vibration and the cold.
So there is, if the cavity is very small, that's the problem, right? Like preventive, again, like catching things on like very early. Some dentists, like my father, I know this because my father, when the cavity was very small, they can use a laser instead of a drill, right? Now, not every dentist has that, but the ones that do, and the cavity has to be small enough, because if the cavity is too big, you have to use the drill. Now, with the vibration is what I was telling you, like, for example, maybe you're gonna have to then work with desensitizing with like a toothbrush at home so that the vibration doesn't bother you. The noise, you can put headphones. The thing is that if the cavity is too big, they're not going to be able to do it any other way, right? And also, I mean, it shouldn't bother. It shouldn't hurt that much once you put the Novocaine, but again, like having to get a needle in your mouth, that's gonna be like a lot. So my suggestion is really be on top of like as hard as it is to get them to brush their teeth, do not give up on that. Just like what Tara was saying, this was important that her client went to a restaurant, right? So that she can be part of the family and going out and whatever. They didn't give up. It was not easy. It was not pretty, right? But they didn't give up. The same thing with brushing your teeth and flossing and doing all the preventive things so that if you get a cavity, it's smaller, because smaller things don't hurt as much. And like I said, you can do preventive things not to get a cavity. But the drill, once the cavity is big, that's we can go to the moon, right? But we haven't developed something, we can kill somebody silent with, but we haven't invented like a drill, but yes, there is, if they're very small, depends on the dentist, they can use they can use a laser, and it doesn't really hurt. That doesn't hurt, that doesn't have any sound, but it has to be a very small cavity, and the dentists have to have that equipment.
And Laura, you responded. I thought you had a good.
Yeah. I was wondering, so I switched dentists, and my new dentist uses like a different technique, which like kind of squirts more water at my teeth than the old one, which was much more like the traditional, like just whirled around. The new one does, I don't know if it's like an ultrasonic or some sort of cleaning that's using water more. I don't know if that's a possibility. If you call around and see if there are different ones that use different drills, there might be a different vibration that might be less intense, or maybe like just spraying the water and getting them used to having something in the mouth, because a lot of dentists do that to kind of clean. Maybe that would help. So you get rid of the sensory of having something in your mouth, you get used to that, and then maybe they hear the vibration and maybe they can feel it, put it against their finger. And then again, that desensitization, like they get kind of more used to it. But I think my son would have been okay with the water first versus like everything going on in his mouth at the same time.
Yeah. And like I said, practice at home with some of the things. I would say for the vibration, I would try to start the process with one of those toothbrushes that are electrical that you can use at home. They're not going to like it, but that would mimic some of the vibration.
Thank you to our sponsors, which webinars are led by Home and Community Positive Behavior Support Network, Positive Behavior Support Corporation, Parent to Parent USA, the Partnership for People with Disabilities at Virginia Commonwealth University, and Parenting Special Needs Magazine. So I just wanted to make sure we got that in there, because I do appreciate everyone that contributes and supports this and sponsors it. So thank you. And
Thank you everybody for coming.
Yeah, and it is 9 o'clock, so we want to be thank you everybody for coming. I appreciate all of you sharing in this informal. We'll have to kind of let everybody see how it went. Jessica, thank you so much for sharing with us.
Thank you, Shante. Nice to meet you, everybody.
Thank you, Jess.
Thank you for everybody for participating. Flip for keeping us on track, trying to. That's right. Tara for all your expertise, and everybody, Marcia, and Molly. So thank you all very much. And we'll see you next time. Thank you.
Bye, everyone.